Okay. We want to welcome everybody to joining us this warm July day. Hope you're having a wonderful day. Hope you get some rain here in the future. I know I'm praying that we'll get some moisture. My lawn at home is burning up. I think it's half green and half yellow right now. And I think I killed all the flowers this weekend from lack of moisture. But what we're going to do is we are offering a CE credit for this class. And at the end of the class, I will provide a code word and a link to an evaluation to fill out. As you remember, when we were live, we always would hand you the evaluations and you would give us back the evaluations and we could give you a certificate. But being virtual, we've found a way of doing that on Google Forms that you'll fill out the evaluation. And then if you'll give me a couple of days after everybody's kind of filled those out, I will email you the certificate. Jason has also shared the slides, so I will send a copy of the slides, and we are recording, and I'll send you a link to the recording so you can watch it again later and stuff. But as we're going through the class, if you have any questions, Jason wants you just to interrupt, ask your questions. If you feel more comfortable to type them, I think he's got his chat box open too, and you can chat or make any comments in the chat box. If any of you feel comfortable enough to sharing screens, or not sharing screens, sharing your cameras and letting us see smiling faces. I think Bonnie just she's got the right idea. You just take a picture of yourself smiling and then you put it out there and no one knows the difference. They all see that smiling face. So, but we want to, again, thank you for joining us. Thank you, Jason, for doing our presentation. And I'm going to turn the time over to you.
Great. I'm trying to share my screen, but it's telling me that it's disabled. So
Is it not? Let me look, actually, because I'm showing you're a guest right now. Let me get you switched over. Somehow that went off.
What's going on, love? Yeah.
You should be a co-host.
Hey, here we go. Terrific. Can you guys see that okay?
It is showing up.
All right, terrific. Well, Michael, thank you so much. And thank you to Provo Canyon for allowing me to have the opportunity to come and visit with you guys today. The topic of the discussion is the power of connection. To tell you just a little bit about myself, I'm from the state of Oklahoma, so please don't adjust your microphones. I do have an accent. It comes in pretty naturally and pretty strong. People always ask where I'm from. And so that pretty much takes care of that. I went to school in a small Division II program out in a place called Tahlequah, Oklahoma, where I got a degree in health and human performance, and I got a master in psychology. I am a person in long-term recovery. So there's a history of being incarcerated and having a lived experience from a recovery standpoint, which doesn't make me an expert. It just means that I have that as part of my journey. Sometime later, whenever I was venturing out here to Utah in 2018, I started my master's program at the University of Grand Canyon. And currently right now, I'm an associate clinical mental health counselor. I work as the community outreach director for the Odyssey House here in Utah. And I work with a great team of people that help reach our community partners and share information about not only our program, but other programs in our community. I've been in the mental health and substance abuse field as a technician. I've worked in the hospital settings. I was an admission counselor, worked in utilization review, and I've done outpatient and inpatient therapy work, working with the Odyssey House here in Utah. The most important thing, I guess, about me that I would like for shared to you guys is that I am passionate about educating individuals and families to help navigating the challenges that are associated with substance abuse and mental health. A lot of things that we experience in this field change pretty rapidly, and especially over the last couple of 2 years or so, they've changed even more. So I appreciate the opportunity to come and visit with you guys about this. I hope that you guys find this helpful and ask questions if you have any. And if I don't have the answer, I'll be certainly happy to find one or find somebody that knows more than I do, which is often the case. So today, what are we talking about? Is it mental health or is it substance abuse? A lot of times working in this field, it's kind of a blur. There are co-occurring disorders and they're happening more often in our community now than they probably ever have. And so it's a real challenge to differentiate sometimes, is this a mental health issue or is this a substance issue? The other thing that we're going to be talking about are barriers to treatment. What are some of the things that providers find? What are some of the things that clients find? And how do those barriers interact with each other? Where is the state of Utah in all this? I'm not sure when's the last time that any of us did some research. When I started this, I looked into this and I was kind of surprised at some of the things that I found. The other thing that we're going to talk about is connection, how we define that, how it, what it looks like from a provider standpoint, what it looks like from a client or prospective client standpoint, and possible solutions, which is kind of where I would like to open this up for you all to help me and help all of us kind of understand the power of connection, where you've seen this work, and where are some areas that we might be able to work together to improve it. So for the purpose of this discussion, we are going to kind of group the mental health and the substance abuse together. While they are very separate and they're very different in regards to how they're treated, we're more looking at the population of substance abuse and mental health as a whole and in the state of Utah and in our community. The Journal of American Medical Association says that roughly 50% of the individuals with this have severe mental disorders are affected by substance abuse. Roughly 40% are alcohol abusers, 50% are drug abusers that also have mental health illnesses. And of all the diagnoses of mentally ill in the United States, about 30% use either alcohol or drugs. So when we have this discussion and we're talking about this population, there are a lot of interconnections, as we found, when we're dealing with whether it's substance abuse or mental health, or is it a combination of both. One of the great things that I've learned about in working in the variety of different levels of care is about some of the barriers that clients face whenever they're dealing with receiving services. Many people that are in need of mental health care or substance use treatment are unable to access it in a timely manner due to provider shortages. So I could ask for a show of hands of how many people know about provider shortages in the state of Utah, and probably everybody would raise their hand. It's something that we've experienced. It seems it's came to the forefront more so over the last year and a half than maybe it has in the past. Of course, I've only been out in Utah since 2018, so maybe this has gone on for a lot longer, but it seems to me that therapists are in high demand. Social workers, case managers are in high demand. And so there really is a shortage here in the state of Utah. One of the other barriers to treatment is as a provider determining whether or not a patient or client meets particular treatment center's admission criteria. I know a lot of times whenever we're looking to make a referral, we are not quite sure if the program has changed or if that program has a different set of criteria, or if there's another additional program in general that they offer that we're just not aware of. Another barrier that we have found is that there are a wide variety of treatment options, depending on the level of care that we need. It can be difficult to understand the effective options and or services patients, clients that are in a particularly ever-changing service environment. I don't know how many treatment programs are offered in the state of Utah, but I do know that there's a lot. And I know that a lot of times it's hard to differentiate. Is it a 3.5 level of care, or is it a 3.1 level of care? Or is it an outpatient or an intensive outpatient? A lot of times the community partners that Odyssey deals with and a lot of you guys deal with offer a variety of levels of care, but sometimes those levels of care based off staffing issues and other factors that are going on are no longer available. So that's an additional challenge. The last piece is probably the most important piece of what I would like to talk about is the communication part. This articulates the difficulties in communication and infrastructure and process between referrers and recipients, which ultimately can increase the time between a patient announces their desire for treatment and the ability for us to get that patient into particular care. So these are just some of the things that we see as providers, that we see in our community as kind of creating a roadblock for us to help provide services and then get those clients to the services that they may need. So where does Utah rank? I don't have all my screens set up, so I can't see all of you, but this is a news article that I'm going to share. Hopefully this comes across as the same. And if it doesn't, please let me know. So it's probably not going to take you very long to figure out exactly where Utah ranks. But in this particular article, they are referencing mental illness specifically. There was a study that was put out by NICE RX, which discovered that almost 30% of adults in Utah suffer from mental health problems, which is the highest reported in the United States. The research that was used was done from SAMHSA's National Survey on Drug Use and Health, and around 29.68% suffer from some form of mental illness, followed by Oregon and West Virginia. So here are your top 10. I know that for me, this was kind of surprising to figure out or to learn that Utah was ranked #1 in this area. This is a news article, as you can see here, and I'm sorry for scrolling so fast, that was published in May of this year, and then it was updated later on in June. So it's relatively recent. Some interesting facts. In the discussion of this particular article, they define mental illness as an acute or chronic diagnosable condition that affect individuals' emotional, psychological, and social well-being, and often their behavior. So the Kaiser Family Foundation does a lot of research and a lot of statistical data on these types of things, and they do a pretty good job of kind of referencing their sources. According to the National Alliance of Mental Illness, 550,000 adults in Utah have mental health condition in 2021, and that's 2 times the population of the Salt Lake City, excuse me. You can look further down and kind of go through this news article, but the message is pretty much the same. There are some interesting facts in here that obviously, they mentioned in here that because of COVID, these numbers were exasperated, and these mental health conditions became even more severe as far as the number of cases. And then as you kind of scroll down, you can look here and see that they're talking about children from the age of 6 to 17, adolescents from the ages of 12 to 17, and depression rates and mental health disorders. And you can kind of look at some of the statistics that they put together. I was kind of alarmed when I look at a lot of this. I think part of it for me is that, like many of you, I'm sure, we work in a way that we're constantly multitasking, and we're working with one while we're still looking or thinking about another one. And oftentimes it's kind of hard to see some of the bigger picture, but I know all of us do a lot of extraordinary work, and it's tough because of the numbers. So it did mention in here that in Utah, 665 lives were lost by suicide in the year 2021, and that's 141,000 adults had thoughts of suicide last year. That's an area that I know that the summit is coming up for the suicide this coming Friday. I've never personally been, but I hear that's a great place to get educational resources. The last piece, when you look at it down here, it talks about the unmet need of clients refers to a person having a perceived or recommended need for mental health treatment or counseling but did not receive care. In the state of Utah, 50% of them basically reported because of cost. And that is higher than the United States average, which was 39.7%. So their research indicates that the cost of healthcare may have been or could have been the reason that they didn't receive those services. I'm personally of the opinion that I think there were some other factors in addition to cost that could have created some barriers, and we'll talk about those here shortly. So I'm going to stop that screen share and just take a few minutes to look at some of the chat, because I missed some of this earlier, and I can answer any questions just to kind of before we transition into the last piece. So it looks like here that Joyce mentions that our PCPs being educated to better understand SUD without judgment. I want to think they are. I certainly believe that we're making efforts in educating our providers to talk about SUD treatment and without having that judgment. I think that for the purpose of this discussion, it's still relatively confusing. And I say that because when we talk about mental health and we talk about substance use, a lot of times there's a little bit of a disconnect between which is the chicken and which is the egg. And I think for that reason, maybe the education piece, while it's warranted and it's great, there are still some components of that that might be a little bit misunderstood. So the next question was from Gina: the highest reported people receiving treatment, isn't that a good thing? Is it? Yeah, I mean, sure it is. If we have the most people that are receiving treatment, that's also meaning that's the most people that need treatment. So I guess it kind of depends on how you look at it. I simply think that we have a lot of services that we offer here in the state of Utah. And I feel like that some of the communication barriers that we have as providers that we don't know about additional resources might be an area that we might be able to improve in. Does anybody else have any questions or comments while we're at this point? I'm open to answer any questions. I certainly don't have all.
Hey, Jason, this is Joyce Kim. Sorry,
Yes, ma'am.
instead of typing it, my question was really long. So are the insurance companies better understanding mental health and SUD in relation to how treatment and the programs are being laid out? You know, they have to fail 2 times outpatient before they go inpatient. Are they changing their stance, or are they really still being hard-nosed about all of that?
From the experience that I have, you have a little bit of both. So in one of the research pieces that I found, because of the pandemic and the primary care, I think is it the Primary Care Act? That there were additional coverages put in place by commercial insurances to provide mental health and substance abuse services. It was part of that legislation. So on one piece, there are. The other piece is probably something that a lot of people don't like to talk about it. That is, and what are the providers seeing from a reimbursement standpoint? And I know that there are some in particular that are still being reluctant to provide or pay for services for detox, for specific forms of detox. And there are additional criteria for providers to receive payment placed upon them by the insurance agency. And I'll give you kind of an example. Some of our hospitals have the ability and are Medicaid providers. However, some of the Medicaid options that are available to our clients, they have certain processes that they have to meet in order for that provider, in order to provide or be able to be reimbursed for those services. So what that means is that while they are available, there could be additional hoops that the provider has to go through for that particular Medicaid client because of the type of Medicaid that they have. And so that, in my opinion, creates a barrier when someone is receiving treatment. Over the course of the summertime, we noticed that our hospital censuses traditionally kind of get a little bit lower. And then during the wintertime and springtime, they're traditionally a little bit higher. What that ultimately does is if there's additional barriers to get clients into services, a lot of times we're not sure how to navigate that. And I have seen where it could create kind of a stigmatism about, well, we don't want to accept these types of clients that have these types of insurances because we can't get paid for them. Well, because Medicaid and insurance companies are always trying to change and trying to provide more coverage, that creates a confusion on a provider side to learn about, to learn more about how to provide these services. So Joyce, I do like your question, is the wait time for services being addressed? And I think that it is. In some of the places that I've personally been in, they've used a timing mechanism. And what I'll give you a specific example. For instance, if a client or if a person goes into an emergency room, they're looked at to be treated, and then they're going to be sent out to a behavioral health unit. Some of these behavioral health units actually have a time frame where they receive that fax, monitor that fax, try to follow up with trying to get the information, and then trying to get that client in. And they actually time this as a system. So I don't know if everybody's doing that, but I do know that there are some certain hospitals that are addressing that need. Any other questions before I continue? And these are great. And I think it's awesome. Atia says, what is being done about the acceptance of people who are in transitional programs? So can you be a little bit more specific to that?
Yeah, so Atia, Youth Advocate Program. So basically, I work with youth that are in JJS, DCFS, CPS, and we've got youth and young adults that are in transitional programs, either being exiting jail, incarceration, what so have you. And a lot of them they do have the mental health or drug addiction to where they can't go back out in that community right now, but they've completed their program or time in the JJS programs. Right. And some of them we try and get them into rehabs or mental health facilities, and we're struggling with the acceptance of, again, I guess the type of cases that we have.
Okay. And specifically, are you finding that barrier is like lack of services provided or right. availability?
It's a mix of both. It like the availability, and then like some of the programs, because of the style of cases we have. So with some of our cases, you know, they've got like assault charges,
right,
and things like that, to where we're not able to get them accepted into some of the programs because they have those charges.
Correct. Right. Atia, that's a very good point. And I'm glad that you were a little bit more specific about that, because we see that too. That's part of something that I think all of us to raise the awareness of are some of the barriers that we face. And I'll give you even a more specific kind of case. At Odyssey House, we don't accept violent criminals. However, we do, or violent charges for those people, but we do look at it on a case-by-case basis. And if you're under the influence during the time of that particular charge was committed, it's all circumstantial. It's all based on individualisms, but that is an option that we can do. Now, we're probably not as transparent about that as we should be. And I'm sure other providers look at the liability and safety aspect of their milieu and some of the things that go on in accepting these clients. But I think that this brings a point to about the communication of, is it a flat standard no? Is it the fact that we don't have the room? Or is it the fact that somebody's understanding or concept of what this client's situation looks like is not 100% accurate to what actually happened? And obviously that goes into admission criteria and a lot of other places, but I think it's worth a communication to know someone that can provide more insight when you're trying to get these clients into these programs. I know that's not a solution, but it is a way for us to raise the awareness of some of the barriers that we have. And I appreciate you bringing that up. So I'll continue on and go forward for just a little bit here, so we can have time at the end to kind of sum all this up. So talking about connection and its definition. Hopefully, like many of you, I'm a Google user, so I Googled it up, and it basically stated that a relationship in which a person or thing or idea is linked or associated with something else. I think that's very basic, and I think that that's pretty accurate. When we talk about relationship building and we talk about it from a variety of different aspects, from a provider standpoint, the relationships we have with our clients, but also the relationships that we have with other existing partners. The thing that we're most associated with is the client. They are the focus and the center of the conversation most generally. And so that creates a connection between us and them. For clients and those individuals that suffer from mental health and substance abuse, this is probably one of the most important pieces that I've found. And that is the feeling of connection, that they belong to a group and they generally feel close to other people. There are lots of studies that strongly suggest this is a core psychological need and an essential to feeling satisfied within your life. I know I feel better when I'm around people. I feel better when I'm around people that are like me. And I know that you all have seen that group therapy and people that are going through several crises, they seem to strive a little better in a group setting for the most part. The other piece here talks about the therapeutic relationship, and there's a couple of different aspects to this. The first one that most of us know about is the therapeutic relationship that a client has with their therapist or their immediate provider, and how that bond can actually dictate and guide some of the treatment services and the success rates of those services. It's defined here as an interactive relationship with a patient and family that is caring, clear, boundary, positive, and professional. So that's kind of a broad scope. But I like to look at the therapeutic relationship through a little bit of a different lens. And that is, how is the relationship that I have with either a provider, a client, or a community partner therapeutic to the client? When we do processes like warm handoffs and there's a transition level of care and they get a sense of comfort and feeling and belonging from one step to the next, it appears to me, and I don't have any scientific evidence to back this up, but that is a smoother transition. It's an easier transition, and it is more of a conclusive transformation for the client. And so I often see when we are transitioning clients in levels of care that there is some sort of a disconnect. And a lot of times that's whether a provider from one to the next doesn't know exactly what's happening. And then we have the conversation and we're not including the client. And a lot of this is personal experience. So I'm not trying to throw all my dirty laundry out there, but things that I've seen where we can improve on is this therapeutic relationship and how each of us are looking at it. Possible solutions, the power of connection. I wanted to get really basic with this, so I really appreciate you kind of bearing with me. But one of the things that I've learned in the time that I've been in this field, which is not all that long, to be honest, is to smile. The people that I work with, we have discussions a lot about a lot of the challenges it is to be happy and to find work-life balance. I think that providing a smile to the people that we work with, not only in dealing with clients, but also the providers and community partners, demonstrates a willingness to try to work with someone to find a problem or to find a solution to a problem. Making eye contact is something that I always try to do. It's a little different here in this Zoom setting, but looking at someone and understanding where they are and trying to meet them where they are is important to building a connection. Having open and honest communication. You know, one of the things that I've really struggled with at times is how it seems that there is a secret between what goes on with providers and their decisions for making levels of care recommendations and then how we include the client in that. Now, that doesn't happen all the time, but I have seen it. And oftentimes what we want to tell the client may not necessarily be what we want to tell them because of the fear of what they may do with that information. And I can certainly appreciate that. But I think that having open and honest communication collectively as a team that includes that client along with what other healthcare and mental health providers is an important piece. Provide and receive honest feedback. That's not only of what we expect a lot of clients to do when they're in our programs, but it's also something that we should do as providers. If we have problems or there's barriers for transitioning clients and levels of care, we should know about that. We encourage that. I'm not saying that you guys don't do that. I'm just saying that sometimes we probably don't do enough of learning about how these processes go to understand when there's an issue. And part of that is because the number of people that we deal with. The last part about the power of connection, and I know a lot of us do this on a regular basis, is trying to meet the clients where they are. It's really tough with waiting lists and the unavailability of different types of treatment and the confusion around where the housing component might be, or where the funding piece might be, or what solutions are even optional to particular clients. It can all be a challenge. Trying to meet the client where they are is very difficult, but if we do that, I think that we're giving everyone a better opportunity for success. I wanted to touch base on this. I know a lot of you guys know about these, and some of you are probably in this meeting. This is something that I've really enjoyed working with, and their lived experience has provided a lot of great insight. So obviously we're talking about the certified peer support specialists, very key in our community. I know USARA does a great job, and other organizations do a great job of employing these. We have them at Odyssey. I'm sure you guys are familiar with them in your organizations as well. The National Certified Peer Program is something that's done from a national level, and then the state of Utah has the Certified Peer Support Specialist here. I first, when I was in the treatment kind of programming realm, I was curious as to kind of what the perception was of somebody who had lived experience that was going to become a therapist, and someone who was, I guess there's this new term called a normie that hasn't had a lived experience in substance abuse. And at first I thought that maybe I had some more insight, but I later found research that basically stated that I don't have any more insight from a lived experience standpoint. So I'm kind of in between. I don't really know, but not that it really matters. The point is this: these peer support specialists are in our community and have a more recent recovery experience. And because of the dynamics of how programs and services are offered, they provide a very valuable insight on where and who and how to get services to clients more readily available. And that is just the experience that I've had. I have the pleasure of working with one on my team, and she's wonderful. And she's been in recovery now for about 4 years, but she's stayed connected to the community, and her lived experiences are providing an immediate answer to solutions that I just simply would not have learned about or known about without her insight. So I really just wanted to highlight how important these guys are and how wonderful they are in the work that they do, and how great of a resource they are to our recovery community as a whole. Talking about other possible solutions, the power of connection. The process of recovery in my personal journey was through relationships and social networks. Finding people that wanted to head in a direction that I wanted to go to, and being around people that wanted to help me, was a key part of me getting to where I am today. The support of peers and friends are also crucial in engaging and supporting individuals in recovery. I know that the lived experience piece is somewhat maybe questionable in the conversation that I had, but I want to kind of open it up to a lens of this. The lived experience that all of you guys have, providers have, also provides a very valuable resource. This is something that I've noticed that people sometimes forget when they talk about different cases or things like that, when they're trying to provide options. But being around people that have lived experience in this is a very key part. And I know that with the influx of new people that are coming into our industry, a lot of them have a lot of ambition, and they have a lot of guidance, and they have a lot of kind of want to do. But the people that's been in this business for a long time, I know Those are some of the people that I've relied on in my experiences to find out. But these other new ideas, also having an open mind of these people that have these lived experiences, is also a great resource too. And kind of the conclusion and the most important part of all of this is people connecting with people. I really love the fact that not only do I work with a lot of great people in my organization, but I've had the experience of working with great people in other organizations. I've noticed over the course, like many of you over the last couple of years, that there's been a lot of movement in transitioning in the roles and the places where people work, but their mission and their goal seems to be the same. And in order to work in this industry, you obviously have to have a passion for this. So connecting people with people is something that's very powerful. And that's the only way that I know of right now that we can start making a dent in some of these statistics that we talked about. Share the information. If I could get on the top of Salt Lake Behavioral Health with a microphone, which I think is a 5-story building, and yell about everything that I've ever learned, I would do that, and people would listen. Part of what's so great about this community is there's so much information out there, but a lot of times we're not exactly sure who knows what. So we just need to share it. I think it's important that when we find resources and resource catalogs and things that are provided to clients to help people get more information, that we share that. And we share it as often as we can. And I'm sure most of you guys do this. I just wanted to emphasize that sharing the information that we've gained is one way to help connect people with people. So when we talk about the power of connection, we can look at some of these statistical pieces. Connecting with others can be a motivation needed for some to begin services. Connection also challenges people's and their perceived limits and expectations. People bond with others over the process of healing and supporting each other. The connection helps people gain additional motivation and are able to progress through recovery. Connection creates a relationship with yourself and is one of the most important and healthy things that you will ever do in your life. When people learn about themselves and construct a relationship, they are learning about their own passions, desires, and needs. And connection creates a feeling of balance, which can improve certain skills such as problem solving, memory, and concentration. So in this scope, we're looking at the connection that maybe clients have with their provider, or clients have with a different transition level of care. But this is more so for us. And I look at this from a standpoint of how being able to connect with people in our community helps me personally. It helps me be motivated because I'm around people that are trying to help others, and how these challenges of connecting with someone challenges me to be better today than I was yesterday. I've noticed over the course of being in Utah since 2018 that I have created a much more of a balance. When I first got here, I really didn't know much about anything, and I don't really know much about anything now, but I do know a few more people, and that's been really encouraging to me, and it's created a balance. Because if you know me, I've probably said this to you before, is I don't know everything and I don't need to know everything. I just need to know somebody that knows more than me. And being able to connect with people has allowed me to provide an additional service. Whereas if I don't have an answer, I may know somebody that may have a solution to that particular problem. By seeking out connection, we can create a community of individuals that we can rely on for support. I know that there are certain people that I work with when I'm looking at transitioning levels of care, or working with people that I trust. And the only way that happened is because I've worked with them time and time again. I can rely on them, and they provide me additional support in order to help clients get to their destination. It has been known for centuries that humans long for connection and bonding, and when this occurs, happiness increases due to the release of endorphins in the brain. And finally, you can build connections with others. Many of you guys have gotten into this field because of somebody you knew or a personal experience, and you've had connections that's helped you along the way. And I just encourage you to continue to do what got you to where you are. I think it's so important that when we look at connecting, that people are willing to help other people. And I know that that seems kind of challenging at times. I know I've gotten caught up with the pandemic at times with social distancing and being on Zoom and all of these factors. But the power is in the connection when people work together. Oh, in conclusion, the last part of this is community. I consider all of you guys community partners. I love this community in Utah. I've grown accustomed to it. I love the fact of the people that I work with, not only with my organization, but with other organizations, the passion that they have. And that passion falls on me too. And so that allows me to continue to drive and continue to go forward based off of what other people do. And that I trust them in certain cases, that when I see them, they're going to uplift me and help me continue going. Because as you guys know, this is a very challenging and difficult industry to work in. There's not a whole lot of victories that we see on a day-to-day basis. However, I know that if you've experienced someone in their journey of recovery and you were a piece of that, the reward that you get from that is just, it's extraordinary. So that is basically my little spiel. I know that there are a lot of areas that I did not touch on, and there are a lot of things that I'm unfamiliar with. And so part of this experience for me was to learn about how I can do better in these types of settings. I have been very fortunate and blessed and worked with some of you that I see here, and all of the connections that I've made along the way have helped me be better than I was yesterday. And so I want to thank you guys for that. The other part of this is that I know that sometimes when I'm working, I get kind of lost in the translation and in the shuffle because I'm dealing with so many people. And I feel guilty about that. And one of the ways how I manage that is I transition that to other people. And I talk about, specifically how I feel and why I felt that way and what happened. And I encourage you guys to do the same. A lot of the principles that we talk about in recovery can be very well used as providers. And I think that that's important that we practice what we preach in certain settings. Does anybody have any questions or any comments, or does anybody have anything to say other than me talking for another like 3.5?
Jason, this is Joyce Kim again. I'm so sorry.
No.
The question I had is, Greg Hughes was a real big advocate for mental health and SUD, and he's kind of out of the political realm now. Do you know who would be the best advocates for mental health and SUD now in the legislative sessions?
I honestly don't, but I do know somebody who does. Recently, our CEO, Adam Cohen, was a part of some of the transitional pieces that's happened as far as the Medicaid dollars that are coming in and this lawsuit that came in, and his advocacy on the Hill helped navigate some of those dollars. And I'll be more than happy to reach out to him to get a name to give you a place to start. I would be more than happy to do that.
Jason?
Yes.
This is Nathan Bedell with the Youth Advocate Programs.
Hi.
One of the concerns that we have is resources available for families, because we work not just with the youth, but also with their families, their parents, to be able to provide support to them. And one of the things that we find is that mental health is one of the reasons why the youth are involved in JJS custody. And so sometimes, a lot of times, their parents are not familiar with what resources are available, where to go for help, because they think it's just a JJS issue. But really, the whole family can benefit from either some sort of family therapy or counseling of some sort. Is there obviously there's a ton of resources out there.
Right.
But it's not always available, either to the families because of cost or income and that sort of thing. Is there a kind of a roadmap that we can use when we're helping families tap into these resources? Is there a go-to to kind of start the process?
Yeah, there are. I don't know of all of them, but what I can do is that I can gather some resources together from our adolescent program. So one of the things that Odyssey does, which I've found so good, but we haven't done this from the adolescent side, is we have a family support group. Now, there are other entities that do that same thing. And that, I mean, you're hitting Nathan the nail right on the head. One of the areas is concerning is about the resources for family members that are dealing with loved ones in addiction and mental health. And so I would be more than happy to compile a list and provide that to you. And maybe you might be able to give me some clarification on this, Michael, is do we have a list of those people that joined this that I could, if I was to put something together, that we could send that out to them via email?
Not exactly, because a lot of people don't necessarily register, but if they do fill out the evaluation, that's where I send all of your slides and the copy of the recording and their CE certificates. So I do have that list, and that's created from attendees. So we do, yes, we do have but even not everybody's here for CEs, but if you're wanting that information, a copy of the slides, a copy of the recording, just fill out for the evaluation, and then I'll include you in that group, even though it'll have the CE on there too. But no, I mean, Nathan, you're exactly right. I mean, there's so many needs, and every need is individual, and there's resources out there. We may not be 100%, but there's resources. But yeah, we need to, as communities, as a mental health community, somehow bring all these resources to the forefront so we know how to access them. And it's tough right now because every entity kind of acts on their own.
Right. Very true. Nathan, I know that I don't want to just talk about Odyssey and that's not my goal here, but I facilitate a family support group through Zoom on Tuesday nights, and it's for the adults population, and it's not specifically to Odyssey. And I've had discussions about doing one for adolescents. Now, I hear that USARA does some, and I think maybe even the youth advocate programs do some, where there is a meeting to some degree where it is basically an online forum or a chat, or maybe it's a Zoom. I'm not specific, but I can find out. And if you register for this and your email is listed, I have compiled, along with several other agencies, a list of resources. And I'm not sure, Brianne has a large list that we have been working on, and I'm sure that she would be happy to share that with you. And in there are some additional support groups for family members, because I put them in there. I just don't have them readily available to me right now.
I also know, Brianne, we've been working with the state and a group trying to put in, it's an app being formed where it's through the state. So anybody licensed with the state, it'll be able for someone to get on and search by city, by topic. That is being put together. I can't remember, Brianne would know what the launch date for it is. I know it's been pushed back a couple of times because somebody else looks at it and says, well, what if we add this? And what if we add this? But I know that source is coming, and that's supposed to be mental health and PCP and hospital, inpatient, SUDA. All of it is trying to be put in there. And that's why it's such a large list. It's just taking a little bit longer than what they thought. So,
yeah. Thank you for that. And that is part of the problem, right? Is that there are so many places, and they come up and they don't, maybe what was available before is not available now, and trying to keep that updated and all of those things. But I know that With our adolescent program, we're exploring new resources, and we're trying to create more information available to the families. And I'll certainly look further into this and visit with Brianne, and so we can get you guys some information about these resources. On the adult side of things, there is a mental health roundtable that is together, and they go every month, and they meet at the they meet at the sheriff's office, and they have provided a resource guide that they've compiled full of a lot of community partners. Brianne has access to this, and there are some adolescent stuff in there too. Right now, it's a 75-page PDF file, and that's probably just a scratch of it, right? I mean, I feel like that with the discussion that we're having, that we could probably get our, minds together to figure out how to, just like Jen said, right, just to be a unified team, to be a unified front. How is it that we can bridge all of our resources together? It's so crazy because I know, and I'll conclude with this, but I know that I come from a background of sales, and that created a very competitive nature, kind of on my part. I come from sports. The one good thing is that we don't have to compete for business. There's so much of it out there that we just need to be more collaborative, in my opinion.
Lynette shared USARA's one of USARA's link, and then also their website, which I'm sure has other links. It's just a matter of, and that's one thing I've loved about these classes is we're learning more and more things. We're learning associations and groups that are out there. It is tough. It is tough. And we're kind of in the middle to provide support for these families and these individuals. And I appreciate everybody getting on, sharing their resources, sharing their information. I wish there was an easy answer, and there's not, but I did. So let me get some housekeeping, because there's many that are going to have to jump off. The code word is Connect 712, and I put that in. And then the link for the evaluation, I just posted it again. So the way that will work, and I do know that some people that Google form doesn't work. Some of you are on iPhone or on phones, so you're not able to really look at it and get your chat and everything. If you need to email me the link for email me if you need the link for the evaluation, and I will send it to you and you can access it. Again, I know some firewalls block you from Google Forms, so just email me and I'll send you the link individually and you can get it. Has anybody had a chance to jump on? Is it working for everybody else? It is working. Okay, good. Please, if you're wanting more information, if you want the information Jason shared, even though you don't need the evaluation, the CE credits, just fill out that form, and that way I know to include you in the email of sending everything out. But I want to take, before we get on, if anybody's got questions, thank you, Jason, for sharing today and taking your time. Thank you, everyone, for joining us, and we will be back. I do not remember we'll be back in 2 weeks again with another class, and I'll send you that class as soon as I've got it, as soon as I apologize. I've been gone. We did the last one 2 weeks ago, and I left the next day for church trek with the kids and then went on vacation for a week. So I am just getting back and getting back to work and into the swing of things. But if any of you need to leave, the link is there. It probably does show the prior title because I didn't remember to get it done, and I did it real quick, and I just copied the last one and changed the title. So it probably does refer to the last class that we did, but if you'll fill that out with the right date, yeah, I'll get it and I'll be able to track it. If any of you have questions, please feel free to continue to ask, and we'll keep that going.
What is the class code?
Connect 712.
Okay, thank you.
No problem. I just typed it in, threw it on there so you can make sure. Natalie, if there's a way, yes, just email me. Or if you want to text. There's my cell phone and you can text me. Or just, like I said, email me. I know a lot of times it's firewalls and that we're finding. Any other questions for Jason? That's good.
Yeah. Thank you, guys. I really appreciate all of you. I appreciate you taking the time, and I hope that we can continue to do stuff together, whatever that looks like. Hope you guys have a great day.
I guess one thing for those that are still on, if you do have questions, he's got the open house on Thursday. You can definitely stop by and really get the connection there.
Yeah. I thought I saw somebody have their hand up, but then I lost her, so I don't know.
I think it was, they were clapping.
Oh, were they? Okay.
Gina was clapping.
Okay. Well, I'm always.
That's like my wife playing emoji figure out with our daughter.
Tell
What
you
that
what.
emoji mean? I asked you a question.
Yeah.
Everybody must be working for everybody. Post that link one more time in case anybody's trying to track it down. Lynette, you're over in Moab. Been a while since I've been over there. That's a fun area.
Well, I hope if anybody has any other questions or any follow-up, they can reach out to me directly. I'm certainly always open to figuring out, how to connect people and do all of that. There's a lot of resources that Odyssey House has used. There's a lot of resources that we're finding in the community, and our team is now dedicated. We have a specialist that's working just in criminal justice, and we have another specialist that's working just in homeless and outreach through the VOA. And we're partnering with USARA and some of the other community partners that are doing some of this work. And we're trying to gather more information about some of the resources that are available. And I know I'll be working with Brianne going forward on sharing these resources and trying to figure out how to put together something. And I know they're so different based on geographic location, right? I mean, there's ones for Utah County and Salt Lake County and Davis County and Moab. And I think that the more we collaborate together, the maybe the easier it will become at some point. I don't know. That's my hope. But I've got several calls that I need to return here, and I certainly appreciate the time, man. I can't
thank you,
thank you guys
Jason.
enough for all your help. Thank you so much for what you
Thank
guys
you.
are doing.
Okay, take care.
All right, you guys have a great day.
Okay, everyone. I hope everyone's got it. We're going to end here.